Hello everyone, you're welcome to my channel. My name is Dr. Tinuade. I'm a medical doctor, I'm a consultant, and I have a special interest on sexually transmitted infections. We call it STIs. And these infections, they're common, especially among the youth. So I'll be talking more to the public. I will limit the medical jargons and speak in a way that you can understand. And the purpose of this channel is for people to realize that sexually transmitted infection is common among us. It can bring complications if not treated. And when you know you have some of the risk factors, for example, if you are somebody that has more than one girlfriend, one wife, you should know that ideally, even if you don't have any symptom of sexually transmitted infection, the best you can do for yourself is always to come to the clinic to screen yourself to be sure that you don't have sexually transmitted infection. Before I continue, I want you to subscribe to my channel because I know you're going to learn a lot from this channel. Now, I was talking about toilet disease. It's a popular language that we hear a lot in the hospital. So let me talk about urinary tract infection first. Sometimes when people have urinary tract infection, they can have what we call dysuria. That means they have difficulty in urinating. It might be painful, very difficult to urinate. Then they have what we call suprapubic pain. That's the lower part of their abdomen, that area where the bladder is. They might be feeling pain or a form of fullness in that place. And some might have what we call polyuria. That means they urinate a lot, more than they normally do. So all this can just be pointed to urinary tract infection, not toilet disease. For STI, they are caused by different microorganisms. And most of these microorganisms, they cannot stay for a long time outside the human host. So that's why we don't believe in toilet disease. Because most of the time, even if somebody is infected with sexually transmitted infection, if the person should use a toilet, before you use it, it's possible that the bacteria that is causing the infection has died. That's what I'm trying to say. That outside human body, the microorganism responsible for sexually transmitted infection cannot survive for a long time outside human body. So that's why it's difficult to contract them anywhere, not even on the toilet seat. But you can have an infection on toilet seats using dirty toilet, which is not sexually transmitted infection. That is what I'm trying to explain. Sometimes you can use a bad toilet. If the water should splash on you as a female, you start itching, you have things like pimples, you have sores, and it's possible for you to even have what we call UTI. But when we talk about sexually transmitted infection, most of the time it is not, because those organisms, they die very fast outside the human body. Then the vulvovaginal candidiasis, when somebody has it, is a female problem, the vulvovagina, that means the candida of the vagina. So in that one, the patients will have abnormal discharge. Normally, female discharges, especially around ovulation, those are normal. But when it's becoming thick, it's cordy, it's like pap, like what we call ogi, and it's itching, you start having sore by scratching, then you know that you're suffering for vulvovaginal candidiasis. So those are the spectrum of toilet disease that a lot of people talk about. So what I'm saying is that if you think you have toilet disease, you might actually have urinary tract infection, sexually transmitted infections, or vulvovaginal candidiasis. Now, going back to sexually transmitted infection now, there was a time that I didn't know much. I wasn't a doctor, but I have a cousin which now she has not given birth. And the problem was when she was younger, she had abnormal vaginal discharge, and people were saying, oh, she had toilet disease. So they treated her for what they thought was toilet disease. And later in life, she came down with infertility. So now that I have an idea, I was able to recollect that, so she has sexually transmitted infection, which was not properly treated. Now she came down with infertility, which is a bigger problem and something that is more difficult to treat. So talking about sexually transmitted infection, I'm going to give an overview today. It's an infection that can be contracted through sexual intercourse, although there are some of them that can be contracted through other means. HIV, for an example now, can be contracted through blood transfusion, also hepatitis B, and they can also be contracted by sexually transmitted infection. Also, when we talk about sexual intercourse, these days, sexual intercourse is not only about vaginal intercourse, and there are a lot of misconceptions, especially about oral sex, which some people will call blowjob, fellatio. Some people believe that so far they don't have vaginal intercourse, they cannot come down with sexually transmitted infection. That is a lie. Oral sex too can lead to sexually transmitted infection. For example, now, if you lick a man that has gonorrhea, you can have gonorrhea in your mouth, and what you have is sore throat. So it's not all sore throat that is caused by viruses these days. So that's why when people come to hospital, we ask them a lot of questions when they have sore throat these days. Unlike before, we just think, it's a virus, so we encourage them, tell them things to do. But now we have to probe further, because sore throat might actually be caused by a bacteria called Neisseria gonorrhea. That's the bacteria that is responsible for gonorrhea, which everybody talk about. Gonorrhea, one of the symptoms of gonorrhea in a man is when they have like all these yellowish white discharge coming out from their penis. So if you lick a man that has that, and the bad thing about sexually transmitted infection is that they are mostly asymptomatic. What I mean is that you can have sexually transmitted infection and you will not even know. You will not know until later in life. When you now come down with complication. There are some people with menstrual problems now, that those problems are actually caused by sexually transmitted infection, because one of the symptoms of sexually transmitted infection, one of them is a lot of bleeding issues in women. They might be bleeding between their periods. They might have heavy messes. Sometimes some people will have pain during intercourse. So those are the things you see when they have sexually transmitted infections. So like I was saying, oral sex too can be a cause of sexually transmitted infection. And the bad one now is the anal sex, which people call doggy. A lot of people come and say they enjoy that doggy so much. People are doing it a lot. They enjoy it because maybe they climax easily and like that. But it's possible to contract sexually transmitted infections through anal sex. Some people lick the anus too. They lick those areas too. And when you do that, if the person you are licking has sexually transmitted infection, you are going to have it. And sexually transmitted infection can be caused by different organisms. So that's what I'm saying. If you are somebody that, you have multiple sexual partners, it's always good to check yourself, because we have bacteria that can cause sexually transmitted infection. One of them is the common Neisseria gonorrhea that everybody knows, gonorrhea, gonorrhea, gonorrhea. But there are other ones that are also common but people don't really know in the public, especially in this part of the world. And that one is chlamydia trachomatis. Is another one that can cause sexually transmitted infection. Apart from chlamydia, another bacteria is what we call Mycoplasma genitalium. That one too can cause sexually transmitted infection. So let's leave bacteria now. Let's talk about viruses. We have viruses like herpes simplex 1 and 2, human papilloma virus. This can cause sexually transmitted infection. And we have parasites like Trichomonas vaginalis. We have things we call pubic lice. As funny as it is, that lice that we see on women here, you see it, this woman has lice. That lice can be down on the pubic ear. People get infected when they have intercourse with somebody that has pubic lice. So it's another thing that even scabies. And before I stop talking today, let me just mention the risk factors briefly. Some of the risk factors for STI, one of them who call multiple sexual partners. By the time you have so many girlfriends, so many boyfriends, there's tendency for you to have sexually transmitted infection. And the bad thing about sexually transmitted infection is that people say, though in a joking matter, they work in groups. They don't work alone, which means if you are somebody that have multiple sexual partner, it's possible for you to have Neisseria gonorrhea, have chlamydia trachomatis, have HIV. That means it's not only one person. It's like one bacteria will be calling for the other one. Say, come. We have a host here. Then other things, we have what we call safe sex practices, like not using condom. Then at this junction, let me talk about condom a little bit. Of course, a lot of sexually transmitted infection can be prevented by the use of condom, but there are some of them that cannot be prevented by the use of condom. Let me give you an example. Let's assume somebody has what we call herpes simplex. This one presents with, you have things like pimples that is filled with water. It can be itchy, it might not be itchy, and sometimes it's very painful. And let's assume the person has it at the thigh, that thigh area, close to the pubic area. You know, there's no way condom can cover that kind of place. So if you have a sexual intercourse with somebody that has herpes simplex on the thigh, by the time you have contact with that person, you can have herpes simplex, and meanwhile, you might be using condom. So for that, condom will not prevent it. Like what we call genital warts too. If you have it at a place where condom cannot cover, if you have a sex with that person, you will come down with genital warts. Genital wart is caused by human papilloma virus. So that is what I'm trying to explain to you. Then have safe sexual practice. That's where people promote one person, one partner. By the time, and there's something we call lifetime partners. That means somebody that since they've been having sex, by the time they've had like 10 people they have slept with all their life, there's tendency for them to come down with sexually transmitted infections. Lifetime sex partners, that's what we call that. And other thing is early onset of intercourse. People that they've been having sex since they were younger, maybe teenagers, maybe since they were 10, 11, those people too, there's this higher chance that they have sexually transmitted infections. So these are some of the risk factors for sexually transmitted infection, and it's important that we take note of it, because sometimes, or most of the time, prevention is better than cure. Sexually transmitted infection, one of the problems with it is sometimes it might be difficult to cure them because of what we call recurrence. For example, herpes simplex might be difficult. Even if you treat the patient, it goes. The virus, they stay in the nerve. They come back later. Maybe the immunity is down, something is wrong with that person. They come out again. So that's why we say prevention is better than cure, and it can be expensive, very expensive, to take care of sexually transmitted infection. I'll be talking on each of these pathogens, the causes of sexually transmitted infection later. I hope you have learned one thing or the other. If you have more questions, you can contact me on 080 344 12609. So I want to call the number again, 080 344 12609. Bye for now.